Controversial influencer Clavicular apparently overdosed in a nightclub in Miami recently during a live stream and is now home from the hospital. Hello and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like and subscribe to my YouTube channel if you haven't done so already. Braden Peters, known on social media as Clavicular or his preferred nickname Clav, is a social media influencer who is at the center of a movement called Looksmaxxing, a practice young men use to maximize their attractiveness to women. Clavicular has promoted extreme measures to achieve maximal attractiveness. He has spoken about what is known as bone smashing, striking his own face with a fist, sometimes with a hammer, to get a more chiseled look on his cheekbones and jawline. The theory being that the bones will grow back stronger and more prominent. He has also described microdosing methamphetamine and amphetamines in general, starting around the age of 14 to stay slim, and using steroids to bulk up. Looksmaxxing is essentially a subculture of young men who are obsessing about looking perfect, and who believe that to get a girl, to get a job, and to be successful in life, they need to achieve a level of attractiveness that is sort of perfect at a subhuman level. The mindset of Looksmaxxing has led Clavicular down a pretty dark and harmful path when you reflect on his recent overdose. And my concern as an addiction expert is that this really poses the same risk for his followers, who are reportedly as young as the age of 13. To help your child or loved one avoid tragic outcomes, we really need to understand the psychological problems that can draw a person to Looksmaxxing and the problems that it can lead to, which include body dysmorphic disorder and addiction. So as an addiction scientist and clinical psychologist, the reason I want to talk about Clavicular today is because what happened to him is a near miss for thousands of young men who are going down the same path. So in following the Looksmaxxing trends and Clavicular's history, I'm watching two things converge. The first is a psychiatric disorder we don't talk enough about, which is body dysmorphic disorder. And the second is the risk of falling into addictive behavior patterns that are disguised as self-optimization, especially in relation to a drug like methamphetamine, which is increasingly linked to overdose fatalities. Looksmaxxing sits at the intersection of both of these things. So in today's episode, I'm going to answer two questions. The first is, what does Looksmaxxing actually reflect psychologically? And how do its behaviors line up with what we understand about body dysmorphic disorder? The second is, how does the Looksmaxxing world both mask and create addictive behavior, particularly the use of stimulants like methamphetamine for weight loss? And what does that have to do with the rising overdose deaths that we're seeing right now? So the first question, let's talk about what Looksmaxxing is. So in its simplest definition, Looksmaxxing is a set of practices that are aimed at maximizing physical attractiveness, particularly facial attractiveness, in young men. It started in incel or involuntary celibate forums in the 2010s, and it migrated into the mainstream media through TikTok and YouTube shorts in the 2020s. So content creators known as Looksmaxxers review topics such as facial harmony, bone structure, and masculinity, despite the fact that they have little or no formal cosmetic training. Looksmaxxers use their platforms to promote ways to maximize, or what's referred to as to ascend, one's aesthetic potential by ranking features like zygomatic projection, which refers to the positioning of one's cheekbones, or canthal tilt, which is the angle that's formed between the inner and outer corner of the eye. And this determines the direction that the eye slants, with a positive tilt, which is what Looksmaxxers are going for, where the outer corner is higher than the inner corner, appearing youthful, and a negative tilt appearing sad or tired. So the community generally divides Looksmaxxing into two tiers. There's soft maxing, which is mostly like self-care. It falls into the domain of skincare and fitness, weight loss, nutrition, and that kind of thing. And then there's hard maxing. Hard maxing is the more extreme form of Looksmaxxing and obviously the more hazardous form. It's surgical and chemical interventions designed to alter facial structure or body composition. So this can include surgeries like jaw surgery or leg lengthening surgery, or it can include drugs like anabolic steroids, peptides, SARMs, which we'll talk about later, methamphetamine and other amphetamines used for their appetite suppressant effects. There's also the category that Clavicular publicly endorsed, which is bone smashing and mewing. So mewing involves forcibly pressing one's tongue against the roof of the mouth to strengthen jaw muscles and enhance jawline definition. And though there's the evidence supporting any change in facial structure as a result of mewing is completely lacking, mewing has amassed over 2 billion views on TikTok. A more invasive example that we endorsed is bone smashing, which aims to alter facial bone structure through repeated trauma, commonly using a hammer. This has amassed over 300,000 views monthly globally, and videos about the practice reach millions of views. So maxillofacial surgeons are battling issues related to bone smashing, which include the risks for fractures with misalignment, neurovascular injury, facial deformity, and alterations in vision. What's embedded in the language of Looksmaxxing is this hierarchy of human worth. It's sort of a scale that maps people from a normie or a person with average looks to a Chad, you've probably heard referred to, which is like a genetically superior, attractive man with hypermasculine features, high confidence, and success with women. For some people, they're really deciding their self-worth or even whether their lives are worth living on the basis of where they place themselves on this Looksmaxxing scale. That brings me to the first question, which is, what is the psychological vulnerability that would draw someone to Looksmaxxing? So let's talk about body dysmorphic disorder, which is a psychiatric condition that is recognized in our diagnostic system, in our DSM, for its core features that include being very preoccupied with one's one or more perceived defects. And I say perceived because these are defects that a person subjectively feels preoccupied with, a defect in their face, a defect in their jaw, a defect in a certain part of their body. It doesn't have to be their face, but it's a perceived defect or flaw in their physical appearance that is not observable to other people. Other people would say, what are you talking about? Your jaw looks fine, or you look fine. Repetitive behaviors like checking the mirror, excessive grooming, or seeking excessive reassurance to where it's bothering other people in your life, or mental acts like comparing one's appearance with that of others and doing that repeatedly and very compulsively. And then most importantly, this is causing significant distress or even impairment in a person's ability to function in their life roles because they are so preoccupied, bothered by it, and so busy taking actions in the interest of fixing it. So a few things that you should know about body dysmorphic disorder as you're listening to this is that it's just as common in men and women. The prevalence rate of it is about 2%. It typically begins in adolescence, so often between the ages of 12 and 13, the same age range as Clavicular's youngest reported followers. And it's associated with an extraordinarily high rate of suicidal behaviors. So there's an estimated tripling in increased risk of intentional self-harm and death by suicide among people with body dysmorphic disorder compared to people who don't have it. Here's how it's related to social media, according to existing research studies. So there was a 2024 meta-analysis, which combined a bunch of studies that found that social media use was positively related to or predictive of body dysmorphic symptoms. And it was strongest for image-based platforms like Instagram and TikTok, driven primarily by appearance-based comparison and internalizing sort of unattainable, often filtered beauty standards. In adolescents specifically, regular use of beauty filters predicts higher dysmorphic concerns about one's appearance. And one study found that cutting back social media use by 50% over 4 weeks measurably improved teens and young adults' confidence in how they look. Now think about that for a moment. You could find a way to cut your or your loved one's social media use in half. They may actually like themselves and their appearance a lot better, leaving them at lower risk for something like body dysmorphic disorder. Now let's revisit those diagnostic criteria again with Looksmaxxing in mind. So the preoccupation with perceived flaws. Looksmaxxing communities catalog flaws with terminology that didn't even exist a decade ago. A young man can spend hours a day evaluating just every nook and cranny of their own face. Repetitive behaviors like mirror checking, taking dozens of photos at specific angles like we see young people doing on social media, comparing oneself relentlessly to an ideal. These are classical body dysmorphic disorder behaviors, and they can be disguised as self-optimization in this context of Looksmaxxing. Bone smashing, this repeated ritualized kind of infliction of pain on one's own face to fix a perceived flaw. This is clinically a form of self-injury on top of a preoccupation with one's appearance. So from a body dysmorphic disorder lens, this isn't self-improvement, this is a symptom. And then the significant distress or impairment that I mentioned, people in these communities report being unable to date or work or even leave the house because they're so preoccupied with the flaws in their appearance. They can't look at their own reflection because of how they feel about their face. Some people become suicidal. So just to be clear, Looksmaxxing is not body dysmorphic disorder for everybody who engages in it, especially when we're talking about softmaxing, trying to improve your appearance through diet, nutrition, and exercise and things like that. Some people are doing these things in a very healthy way, but the hard maxing end of it that Clavicular has promoted provides sort of a culturally validated language and even a toolkit, I'd say, for engaging in body dysmorphic disorder symptom-like behavior. It's really telling someone whose brain is compulsively preoccupied with their perceived flaws that there's a community that totally agrees with them, sees the same flaws, and has some solutions to sell. So let's talk about how Looksmaxxing masks and creates addictive behaviors, because this is important to Clavicular's story, and this is one of my primary concerns. Looksmaxxing creates what I would call sort of a permission structure for substance use. It's a culture that openly takes anabolic steroids, SARMs, or selective androgen receptor modulators, often used illegally for bodybuilding and carrying serious health risks, peptides, and growth hormone in the name of physical optimization. So this is where the line between a supplement and a drug really starts to get blurred. And once that line is blurred, far more dangerous substances can start to slip through. So Clavicular has reported using amphetamine starting at age 14 to stay slim and progressing to microdosing methamphetamine. So this is like two things going on at once. It's a pattern of addictive behavior beginning in adolescence, and it's also a pattern of using a highly addictive drug in the service of an appearance goal. We know that studies of people with a methamphetamine addiction and who are in recovery from methamphetamine addiction show that one of the primary motives that started people using methamphetamine in these studies is for weight loss. And then it spirals out of control as they form an addiction to it. And this is what people often don't realize about methamphetamine. What methamphetamine does in the brain is, if you think about what happens to your brain when you engage in a pleasurable activity like a normal one, like eating your favorite food or a juicy hamburger or having sex, these are natural rewards that create a response in the brain of releasing our pleasure chemical, which is dopamine. So imagine that great feeling. Now imagine that tenfold, 10 times more dopamine being released into your brain. That's what happens when you take a drug like methamphetamine. And this has been documented in research studies that measure specifically the dopamine response and the magnitude of that response. So this is at the core of why drugs like methamphetamine are so addictive. You can't get that feeling from anything else. But the other thing that happens when your brain is releasing that much dopamine is that your capacity to produce dopamine gets depleted. And when that happens, it becomes harder to experience pleasure and joy from normal things. And that's where you start chasing that high and that feeling that methamphetamine brought you. That's where you often hear the phrase chasing that first high. That's a real thing because of the way in which the brain chemistry has been altered as a result of releasing these unusually large quantities of dopamine into it. The other thing that's critical for you to know is that there really is no safe microdose of street methamphetamine. Any dose of methamphetamine is going to carry health risks, including addiction. And we know also that the mortality picture in relationship to methamphetamine is also changing. So we talk a lot about the opioid crisis, but now we're in what's referred to as a fourth wave of that crisis, which that overdose crisis is driven by stimulants, particularly methamphetamine, because often unbeknownst to people who are using it, it can be laced with highly potent opioids like fentanyl, creating an overdose scenario. And here's the part that I really want anyone with a young person in their life to hear. When someone is hiding their drug use behind a wellness or self-optimization kind of frame, it can be really hard for the people who care about them to recognize what is actually happening to them. You might think, oh, they're just trying to lose weight, or they're microdosing something to stay focused, or, looking great, because initially you look good when you lose a little bit of weight. He's saying he wants to look his best. What gets missed in the constellation of warning signs underneath is that you can have symptoms like significant rapid weight loss without really a rational dietary explanation, a person who can't sleep, so they're staying up 24 plus hours at a stretch. They're starting to experience mood swings, irritability, and paranoia, which is one of the signs that levels of methamphetamine or another stimulant are becoming toxic in their brain, sort of withdrawing from in-person relationships. This pattern can indicate sort of an evolving addiction scenario. Finally, what do you do? What do you do about this for your kid, for your loved one, and even for yourself? I just want to make a few points. The first is that body dysmorphic disorder is a treatable condition. We have therapies specifically used for body dysmorphic disorder. Sometimes those are combined with medications that have solid evidence behind them, such as what are known as SSRIs. People do recover, but they have to be diagnosed with it first. And this is one of the most concerning aspects of Looksmaxxing, is that it's sort of normalizing these behaviors under the guise of wellness. Second, methamphetamine addiction is also treatable. There aren't any FDA-approved medications for it, but we have highly effective psychotherapies, including cognitive behavioral therapy, motivational enhancement therapy, and another intervention known as contingency management, where you provide incentives and rewards for abstaining from use of methamphetamine. Lots of data behind this. These approaches, I and my colleagues at UCLA have been involved in many of these studies. There is, contrary to some of the more widely held beliefs that addiction to drugs like methamphetamine is sort of a life sentence, these types of addictions are very treatable. And in fact, the outcomes of treatment from these types of addictions are similar to other addictions. And so there is certainly hope and effective treatment available. Third, and this is a point I want to underline because it has been on my mind since I read internist Dr. Lucy McBride's recent piece on health influencers. She writes that in the age of health influencers, podcasters, and wellness personalities, the line between doctor and medical expert has blurred almost beyond recognition. So she lays out a single framework for any of us who are trying to figure out who to trust with our health. Ask whether the person completed a residency, whether they're board certified, what they're actually trained in, and what they're selling. There are ways online that you can verify any U.S. doctor's board certification at no cost. Now, let's apply that to Clavicular. He has no medical degree, no license. He's a 20-year-old influencer using his social media platforms to recommend potentially harmful surgical or chemical interventions to an audience that includes 13-year-old kids. That is exactly the dynamic that Dr. McBride is warning about in its most extreme form. Before your kid or loved one takes anything an influencer recommends, run them through those 4 questions. And then finally, think about what your kids are consuming on social media and learn how to monitor and restrict their exposure to this toxic form of social comparison that's being promoted by influencers. And for those who know their kids or loved ones are aware of Looksmaxxing trends, talk to them about Clavicular's overdose and how Looksmaxxing in its extreme form created a path to harm. If you're a parent, a friend, or a partner, someone who's spending a lot of your time weighing yourself or feeling very preoccupied about your appearance, comparing yourself to other people, or doing some of these extreme forms of looksmaxxing or hard maxing to try and change your appearance, seek professional help. If you have body dysmorphic disorder, there are very effective treatments that are available right now that can help you. I want to thank you for being here. I hope you learned something valuable, and I look forward to seeing you next time.